stretch, again, I'm going to look for tight places. And because the posterior aspect of the glutes, max and posterior med, is external rotation, it stretches when we internally rotate the femur. And if I want to change the length, then I go back and forth between the two. So I sink in. It's a bigger muscle, so I use my whole fist. You could also, after it's warmed up a little, you could begin to use your elbow gently, or in some cases more deeply. Okay, so it's a big muscle, or a big set of muscles, so it's worth finding a bunch of different places. You can also do little circles. This is where it's useful to remember. Remember, there were two main ones I wanted you to notice in the deep six, deep under the glutes. There was the piriformis, and then there's the set that's more like back here. So I want to check because these might be tight, even if these are not. In this case, it's more this, less this. Look at this. This quad doesn't stretch as far as the other one did. So it might be worth doing more PNF on this side if we had more time. Okay, so this is pin and stretch.
Do you think that maybe it's because of her accident, so she's compensating?
It could be that these quads are working harder, so they're tighter. Yeah, that they're doing, yeah, could be. Okay, I'm going to come around. Same thing. And besides these lower rotators in the piriformis, you can also think about the medius here on the side. And because some of the medius internally rotates, as you get more over toward the side, it becomes more valuable to go this direction. And then do I have piriformis release next?
Mm-hmm.
Okay. So that's the one that goes like this, and that can compress the sciatic nerve. The positioning for it, let me know if this feels okay to your joint as we do this. We're going to flex your knee, externally rotate, and bring you out like a band. Okay. And look, the hip flexors on this side are pretty good, because when they're tight, then this whole side pops up like that as we do that. And that would tell you tight TFL and maybe tight psoas. Okay, now I'm going to use my leg again. The strategy for this one is we're going to shorten the muscle passively as much as we can. So it's kind of the opposite of what we've done before. So the muscle piriformis comes from the edge of the sacrum. And actually, since it's deep to the glute maximus, and glute maximus also comes from the edge of the sacrum. So that's one of those, okay, so how do they both fit there? And if you look in detail, piriformis actually starts just on the inside of the sacrum, just inside, like the deep side. Okay, so I'm lining up, if you don't have a sense of how to find the sacrum, then you can come in like this from the side until you hit bone. And then once you've found it, I'm going to line up my hands, depending on the person's size and your hand size, either like this or like this, all along the attachment. I think this probably releases glute max sometimes too, because of it's in the same, there's so much the same about where it is.
What are you doing with your leg then?
Okay, with the leg, okay, so the piriformis goes like this. I'm trying to have the leg pretty much continue that direction, her leg. Continue that direction, so that so now I'm trying to compress it inward right along that same line. So I'm basically pushing the origin, the insertion of the muscle closer to the origin. So I'm passively shortening the muscle instead of passively stretching it. And then at the same time, I'm sinking deep in right at the origin. This works. I know I was taught it, it's called the piriformis release, and it works like 95% of the time.
Wow.
But I wasn't taught why it works, and my best guess, thinking it through, is that it concentrates all the stretch at the origin, because we passively shorten the rest of it. And, how do I put it? There's two things maybe going on. We can actually figure it out as, okay, because the spindle cells are getting reassured because they're getting shortened. We've shortened it, so they're not going to contract to protect the muscle. And we're stimulating the tendon organs because we're pressing into them. So they are going to be stimulated, and so they're maybe going to think, oh, too much load, I better let go a little, release. And somehow between those two, and then I didn't even really need to stay this long. You can work your fingers around if you like a little bit, back and forth, or little teeny circles. And then if you recheck, very often that's a whole lot looser afterward. And sometimes then you can feel deeper layers that are still tight, or you can feel like maybe now you can isolate gluteus medius is still tight, and you can feel it because the other, what was on top of it is released. That's why I think glute max gets released with this too, because that would be on top. Okay. Now, before you reposition, this isn't in the notes, but I discovered that this is a great position to do some compression in. And sometimes that feels really good. I'm going to do the other side quick because it was tight, and just show you how quick a move this really can be. And you can do it with somebody on the floor if they're in pain and you're not in a massage setting, and sometimes just that. And why did I want you to remember piriformis specifically of all the deep six?
Sciatic nerve.
Sciatic nerve. So if someone's complaining, is this okay? Feels a little tighter in the flexors here. And you need the knee to come all the way up past the edge of the table, or else your leaning in isn't going to change the muscle length. So if they've got sciatic pain, this might relieve it. All right, so I'm looking for the edge of the sacrum. I'm leaning in and lining up and pressing. If I had to press very hard, this wouldn't be the greatest body mechanics, but it doesn't take that much. So this is usually not a body. The fact that I'm not right on top of my hands doesn't really matter.
How many seconds would you say you hold it then?
This might have been enough already.
So you're going by feel and not for
Yeah.
a certain amount of time? Okay.
Yeah.
So the sacrum goes like this, right? So you're going,
It's, let's see, it's like this.
right, so
Yeah.
you're going in,
So,
like downward,
right.
and then very gently.
Right, so I'm trying to be right along the edge of it. If I were doing both sides at once, my fingers would be outlining a lot of it. And then once I found it, I'm trying to have basically my fingernails up against the edge of it as I sink
Oh,
in.
nice.
So I'm going down toward the table. Occasionally when it's really tight, this feels intense. If they get a nerve pain sensation as I'm doing this, like shooting, burning right down the sciatic nerve, then
You're gonna stop it.
yeah, then you would stop, maybe reposition, see if you can find other ways to release it.
Maybe a cleanup.
So what if the other,
GB29?
one of the other deep six muscles contracts?
While you're doing that,
Yeah.
let's see.
I don't think they do, isn't it because they're in internal rotation?
They're not likely to because they're being passively shortened.
Mm.
So,
Gotcha.
yeah, I don't think anything that we're doing would make them do that. If they did, let's see, I would want to try to make her internally rotate. That would be tough in this position.
Mm-hmm.
But that would be, I would probably have you turn over and stretch it. But first I could have you do this and try to have you resist, like maybe I'd put my hand here and have her press into my hand with her foot.
Sure.
We'd try to figure out some way to do that.
Yeah.
So I like how you're thinking, because it shows if you understand the principle and even not everything, but enough about the muscles, you can apply it anywhere on the spot.